Good afternoon, and thank you for joining me. Today's topic is social determinants of health. By the end of this presentation, you will be able to identify the social determinants of health. You will understand why social determinants of health are so important. And finally, you will understand the impact of social determinants of health on individuals and communities. So, what are social determinants of health? Well, social determinants of health are non-medical factors that affect a patient's health. Social determinants of health include economic stability, physical environment, education, food, community safety, and social context and access to healthcare. The collection, access, sharing, and use of social determinants of health help to improve decision-making and health inequities in meaningful ways. Social determinants of health are important. They're important to individual health because they capture information on the individual, which offers a valuable insight into factors that influence health. Socioeconomic status is found to be one of the strongest predictors of illness and death worldwide. It's also important to community health. Many are facing unsafe neighborhoods, discrimination, or trouble accessing quality healthcare services. Racial and ethnic minorities are more likely to live in areas with higher rates of violence and unsafe air and water. Some are exposed to occasional hazards like secondhand smoke or loud noises due to their jobs. And data collection and analysis to help people get the support they need is the driving force behind collection and use of data when it comes to social determinants of health. Let's take a closer look. In the next few slides, we're going to look at specific examples of social determinants of health. We will also look at specifically economic stability, education, healthcare, social environment, and community environment, and their places as social determinants of health. When we talk about economic stability, what we're talking about specifically are work environment and wages, food security, and socioeconomic status, which includes income, level of education, and occupation. Four key issues underlie economic stability. Employment. Increased unemployment rates correlate to increased rates of illness and premature death. Food insecurity. Not having enough food or being able to access nutritious food. Housing instability. Housing insecurity has been linked to worse health outcomes such as high blood pressure, respiratory conditions, and exposure to infectious diseases. And finally, poverty, a key component of economic stability, and it has a strong correlation to poor health. The resources you see here can help obtain housing, food, and employment for those in need. The housing resources from the U.S. Department of Urban Development, or HUD, Office for Family Assistance Temporary Aid for Needy Families, the U.S. Department of Labor, and the Centers for Medicare and Medicare Services. So let's take a deeper look at education. Usually, people with access to quality education throughout their lives statistically tend to be healthier than those that did not. Education allows for upward mobility, allows for better financial circumstances to access quality health care, and keeps patients better informed about how to take care of their healthcare concerns. Education is a key social determinant. Education is a key social determinant because of how it impacts the other social determinants of health. There's a positive link between educational attainment and cardiovascular health. Those who do not complete high school were more likely to have chronic conditions, be in poor health, and more likely to experience mental health challenges. Racial health disparities mirror educational disparity. Bachelor's degree attainment is concentrated among white people more than Black, and Hispanic people have less than a high school degree. Is healthcare itself. which includes access to or lack of access to community-based primary care, emergency healthcare services, general health literacy, and to be noted, people with lower socioeconomic status on average have poorer health and die younger than those with more favorable socioeconomic status. When it comes to healthcare, access and quality concerns are at the forefront. Many people in the United States do not have access to the care they need. Lack of health insurance, lack of transportation, inability to afford medications. Those without insurance are less likely to have a primary care physician, and patients may not get access to preventive care and treatment for chronic illness. There's also quality of care concerns. Lack of funding may decrease provider ability to provide quality care to patients or to enough patients. To not be overlooked, the social environment is also incredibly important to the social determinants of health. Access to or lack of an adequate job, good paying jobs, food security, a safe place to live, being isolated from others, safety, and a lack of a sense of community. Community, I'm referencing the presence of lack of sources of healthy, affordable foods, access to public transportation, crime prevention, strong enough police force, accommodations for those who are already living with disabilities, access to clean air and water, safe and affordable housing, and finally, access to good schools and places of work. Community and social environment are incredibly important to the social determinants of health. So why are they so important? Well, community has a major impact. Interactions with community members has a major impact on health and well-being. Positive relationships can help reduce some of those negative impacts. Support for children whose parents are in jail often don't get support. Support for those experiencing bullying or discrimination. Other community factors include proximity to hazardous waste sites and noise pollution. Exposure to noise pollution may elicit stress responses, and it's also been associated with hearing loss. Adults living near coal-burning power plants, for example, were more likely to report respiratory, gum, and skin conditions. Since we've reviewed some of the social determinants of health, let's talk about some of the benefits of the capture, the use, and exchange of that information. The integration of social determinants of health into clinical decision-making can help reduce medical errors and increase efficiency. Shifts to value-based care models could incentivize prevention and promote improved outcomes. Predictive analytics can identify populations facing high social risk and enhance patient security and experience. We've reviewed some of the benefits, but let's talk about some of the challenges. Challenges of capture, use, and exchange of social determinant of health data are for a few reasons. Lack of standards to encourage collection of data. There's not any hard and fast rules about how and when to collect this data. Some lack technical capabilities to support the interoperability. Not enough computer systems, not enough smart computer systems to help us manage that data. Privacy and ethical concerns. We have to make sure that PHI remains safe. And finally, social determinants of health data is vastly underutilized. Payment models and quality measures don't account for social determinants of health, and practices with lower risk patients are rewarded, and those with sicker patients lose out on incentives financially. Let's take a look at what AHIMA's position is on the use of public policy to collect, access, and share social determinants of health. AHIMA supports the use of public policy to encourage the collection, access, sharing, and use of social determinants of health to enrich clinical decision-making and improve outcomes. They support the establishment of global standards to promote data capture. They promote the ethical collection and use of social determinant of health data, and they prioritize privacy. As we've previously discussed, and as we all know, patient privacy is paramount. We know that AHEMA does support a lot of the efforts being made, but how are current health policies advancing efforts to collect, use, and exchange social determinant of health data? Well, the U.S. Department of Health and Human Services supports federal, state, and local level efforts and policies to address social determinants of health and social need. The Office of Environmental Justice improves health in disadvantaged communities. Social Impact Partnership to Pay for Results, CIPRA, funds social programs and redirects funds from ineffective programs. The Deputy Secretary Quality Summit discussed how current quality programs can be better evaluated and adapted to focus on improving outcomes and develop an aligned reporting structure. Federal laws regulate air and water quality. Urban design promotes increased vegetation on city streets and building rooftops to help improve air quality. Health assessments determine appropriate levels of care and support for patients. Examining current practices of data collection. And finally, allowing for coders to use social determinants of health codes based on documentation from any clinician involved in the patient's care. That can include social workers, community health workers, and case managers. In conclusion, today we've seen the importance of social determinants of health and the impact of health policy on the collection and use of this data. As providers of healthcare services, we should be asking ourselves, what can we do to help further this important initiative? Moves are being made to allow for wider use of social determinant of health data in billing and coding, but we have a long way to go before the full potential of this data can be realized. Thank you for your time today, and please check out these sources for additional information on today's presentation.